Hi everyone, I'm Dr. Bornali Datta, and today the burning question, is COVID-19 pandemic over? Have we seen the last of it? Can we breathe a sigh of relief? These are the questions that's in everybody's mind and one that we will be discussing today. Now, while the COVID-19 no longer has pandemic proportions, it is by no means over. It is certainly there, and as we know, there are pockets of cases which are rising in different parts of the country, different parts of the world, and we can see little spikes and blips every now and again. So it is definitely still there within the population. Why does this happen? This is because COVID-19 is an RNA virus, and that tends to mutate. That tends to mutate very often, and therefore we get variants and subvariants. Some of them are much more severe, more virulent, and some of them are milder, causing a lower degree of symptoms as we are seeing at the present time. So what is the current situation? I would say the current situation is evolving and continues to evolve. This is the situation where we say that the virus is endemic in the population. This is endemicity, where the virus is in the population, and every now and again it will create a variant that will cause it to create a spike of cases in certain populations, in certain clusters. The virus has not yet gone, but it is much milder. Should we panic? No, we don't need to panic, but we need to stay in a state of continual preparedness. We need to be prepared that the virus may mutate to a form that is much more severe and may cause problems again. I think it is important for us to understand that. So we not only stay in a state of preparedness from the healthcare and from the people point of view, but the government's continued investment into COVID-19, containing it, is also needs to stay ongoing. We cannot yet stop worrying about the pandemic. The momentum that we have from dealing with the pandemic, we should not let go of that either. The government, lay people, and healthcare workers at all times anyway have been very sensitized to healthcare issues. We are far more aware of health and other diseases thanks to the pandemic. We cannot let go of that. We need to plan and prepare ourselves based on scientific evidence. We need to have diagnostic platforms, strategies, tools which can pick up cases much faster in a cost-effective manner. We need to deal not only with COVID but also with other diseases which are prevalent throughout the world. So we need to have diagnostic tools. We need to have multi-platform, convergent diagnostic systems that will deal not only with diagnosing COVID but diseases as well. That would be a health for all, a comprehensive health care approach. What about therapeutics? We need to also ramp up our research on therapeutics and treatment so that we have faster things which work faster, drugs which works faster for COVID and for other diseases. We have seen the speed with which we can achieve, like the vaccines that were developed within 12 months, which is unheard of in the history of mankind. We've seen therapeutics, drugs which have been developed rapidly to deal with the pandemic. So this momentum is vital for other diseases as well, so that nothing gets neglected. And we are going full steam with full momentum towards achieving this. Apart from the government's impetus, the healthcare system's research and care, we need to make sure that our public is aware of where things stand. The public will be the first to say, okay, can we get rid of masks? Can we stop doing hand hygiene? Can we go back to our lives, which used to be very chaotic, but that's what we are used to. It's important for the public to be aware that the precautions that COVID prevention needs to continue. We need to avoid crowded areas. We need to mask in confined spaces and crowded areas. We need to continue to do hand hygiene. These are good health practices that we must not stop doing. The virus is quieter now, but it has not quit, so neither should we. Let us prepare ourselves for the future waves that may come and for the disruptions that it may cause to the healthcare services and our lives. Remember, if the last 3 years have taught us anything, it is this: health is everything. And on that note, thank you.